Hello and welcome to the Compass Health Activation webinar series, Best Practices for Creating Health Plan Moments of Magic. This is Dr. Eric Bricker, your host-in-chief for today's webinar. I'm truly excited to be able to speak with all of you today. We have many of our existing clients on the phone, many of our existing broker and benefit consulting partners on the phone. We have prospective clients on the phone. We have brokers that are new to the Compass family joining us. We have Compass employees that are joining us. So really welcome to all of you, and we are super excited to have you. And let me go ahead and show you a picture of yours truly. Many of you know me and I know you, which is great, but for those of you who don't know me, I am the Chief Medical Officer and co-founder of Compass. I'm a general internist, did my residency training at Johns Hopkins in Baltimore, Maryland. I've actually done diabetes research and hospital-acquired infection research as well. But before doing all that, I used to be a hospital finance consultant. So I used to be back in the billing and business office of major medical centers, dealing with the same claims issues that you as employers or broker consultants or the carriers deal with, but I was on the flip opposite side. I was on the doc and the hospital side of the claims because, believe it or not, docs and hospitals have a hard time getting paid. So they hire outside consultants to come in and show them how to do that. So it was a wonderful experience, but wanted to be more clinically oriented, so went on to medical school and residency, and really just saw a lot of confusion and frustration at the patient bedside, and wanted to take my sort of doc and hospital insider knowledge and bring that to companies and employees. And that was really sort of the beginning or the genesis of Compass. I also wrote a weekly blog that many of you subscribe to as well. That's won a couple of honorable mentions as well. And there is a picture of Compass HQ right there. We're in the Bank of America Tower in downtown Dallas, tallest building in the city. We're up on the 57th and 58th floors, so right about there, burning the midnight oil. And we're actually up to close to 300 employees, over 2,000 employer clients. We were super excited to have our over 1 million solution. We've helped people navigate the healthcare system over 1 million times. As of last August was when we surpassed that. We're, as they say in Texas, this is not our first rodeo. And so for many of you that have come along for the ride, we're super appreciative. It's just an honor to be able to work with you and your employees and their family members. And so in talking about creating moments of magic, let's talk about health benefits and how they are directly or indirectly involved in many, if not most, of the events that mark our lives. So these are very significant moments that your companies and your benefits can be appreciated in the lives of your employees, and that we can really bring value to employees and their families. And health benefits exist to make life's critical moments less stressful, so we can focus on the people and things that matter most. And those health benefits really are health benefits experiences. So that's really what we're going to be talking about today, are these health benefit experiences that mark these moments either with added joy or added pain. And now I'm going to pause because I was in Houston about 2 months ago, and I was speaking to one of their big sort of health coalition leaders for employers, and he said that he meets with employers all over Houston, and from mid-sized employers to big multinational conglomerates, and whenever he meets with them, he says, hey, what are your 3 biggest problems? And they almost invariably come back to him and say, my 3 biggest problems are cost, cost, and cost. So if the 3 biggest problems in health benefits are cost, cost, and cost, then why in the world are we talking about experience? Well, the reason that we're doing that is because at the end of the day, the healthcare cost problem is really our problem. It's really the company's management problems, it's the executive problems, it's HR's problem, it's the benefits manager's problem, it's the broker's problem, it's the benefit consultant's problem, it's Compass's problem, but it's not necessarily the employee's problem. The employees, their problem is really around, hey, I'm just getting married and I want to add my spouse to the plan. Or we're moving and we need to find a whole bunch of new doctors that are in network in my new area. Or I've just had a baby and how are these bills going to be covered? And what's going to be covered? And how is it going to be covered? Et cetera, et cetera. Or my loved one or family member is in the hospital. How is that going to be covered? Can we find a physician that's competent? Et cetera, et cetera. I mean, that is what employees really care about. It's these experience with their benefits. And all of you know that the very first thing that pops into their mind is, oh my goodness, what are the financial ramifications of this to my employer's health benefit plan? No, that's not what they're thinking. They're thinking about their own experience. And so that's really, to solve the healthcare cost problem, we have to solve the health benefit experience problem first. To solve the healthcare cost problem, we have to solve the health benefit experience problem first. Why? Because in order to solve the healthcare cost problems, we're just going to need to have the employees change behavior, right? The famous definition of insanity by Albert Einstein is doing the same thing over and over again and expecting different results. So if we want different results from a cost perspective, then we're going to have to do different things, and the employees are going to have to do different things, and their family members are going to have to do different things. Well, if we're going to expect the employees to do different things, we have to solve their experience problem before they're going to help us solve our cost problem. If I'm an employee, why in the world would I ever help you solve your cost problem if you're not going to help me solve my experience problem? So that's what we're going to talk about today. Solving, because really those employees and their experiences, those are our customers. As employee benefits professionals, the employees and their family members, they are our customers. And so we're going to talk about this book, Amaze Every Customer Every Time, by Shep Hyken. He was the speaker at the Compass Health Activation Conference that we had in May. For many of you that were on the phone, you were there. We had it in Dallas at the Belo Mansion. It was fantastic. We had many people come in from out of town as well. If you were not able to join, a lot of the content from today is what we talked about at that Health Activation Conference. And so basically, what Shep says in his book is you have these moments of truth, these points of interaction between ourselves and employees and their family members. And those moments of truth can then be translated into one of three things. It can either be a moment of magic, where it's just a really magical experience. Like, that was great. I got what I needed when I needed it. It could be moments of mediocrity. It was just sort of a meh experience. Or it could be a moment of misery. This was awful. It was cumbersome. It cost me a lot of time. It cost me a lot of frustration. It cost me a lot of emotional stress. It cost me a lot of money. It could be a moment of misery. So how do we turn all of these health plan moments of truth into a moment of magic as opposed to just a moment of mediocrity or a moment of misery? Well, the first step is to actually talk about, okay, well, what are the moments of truth for your health plan? Well, let's start in the upper left-hand corner and go through 1, new hire orientation, 2, open enrollment, family member using your benefits for the first time, seeing a new doctor, getting an annual physical, filling a prescription, getting a medical bill, having a major surgery, retiring or changing jobs, transferring to a new job location, having a baby, adding a spouse to your plan, needing healthcare while traveling, receiving a diagnosis, going to the emergency room, and getting an EOB. These are all very common moments of truth where employees and their family members are our customers in interacting with our health plan. So will these experiences be moments of magic, moments of misery, or simply moments of mediocrity? So this is a fantastic experience, because what we're going to do today is we're going to learn from the Compass client base. So we surveyed our Compass client base, and we asked them, how often does your company consistently deliver an above average experience for each of these moments of truth? In other words, how often do you create a quote unquote moment of magic when you have one of these moments of truth? And this is what your peers at companies across the country and employers across the country said. So the green are the above 50%. And so they said 1, open enrollment, new hire orientation, and seeing a new doctor. Those were moments of magic, anywhere from 55 to 66% of the time. Okay, pretty good. Now, in the yellow, so more than 40%, but less than 50%, getting a medical bill, getting an annual physical, getting an EOB. Now, in the 39% and below, you can see there's a lot of red on here. So this is where our respondents have said that they consistently deliver an above average experience a minority of the time. So not very often, in terms of 1, filling a prescription, 2, having a major surgery, 3, going to the emergency room, 4, needing healthcare while traveling, 5, adding a spouse to your plan, 6, receiving a diagnosis, 7, retiring or changing jobs, 8, family member using benefits for the first time, 9, having a baby, and 10, transferring to a new job location. So what do we have here? a lot of opportunity for improvement. And I appreciate the honesty and the candor of all of our employee benefits peers in answering this way on an anonymous survey. So what we're going to do today is we're going to share best practices for creating health plan moments of magic from your peers. These aren't Compass ideas. These are ideas that have been implemented, have been tested, have been measured at other employers across the country. So 1, family members using benefits for the first time. 2, retiring or changing jobs. 3, addressing issues with the insurance company. 4, open enrollment. 5, receiving a diagnosis. And just 6 general recommendations. So we're going to talk through each of these 6 categories and how other companies or employers have created moments of magic in these 6 general areas. So area number 1, family members using benefits for the first time. The challenge is that dependents can often account for anywhere from 30 to 60% of a group's claim spend. And the largest sort of diagnostic areas for those spends, the top 3 almost invariably are musculoskeletal, diabetes, and cardiovascular disease. And it's heard me before, musculoskeletal is actually typically broken down into sort of multiple categories. So oftentimes MSK is its own category, but then you also see injury and poisoning. So again, fortunately, most people are not poisoned, but the vast majority of that is not quote-unquote poisoning, but it's injury, and it's just typically musculoskeletal injury. So those injury and poisoning can oftentimes be thrown into the MSK bucket. And then the other big bucket is called pain and discomfort, and that typically is musculoskeletal quote-unquote pain and discomfort. So again, you could throw that into the MSK bucket as well. So if you really roll those 3 together, it oftentimes is the largest diagnostic category. Cardiovascular disease is typically number 2, and actually number 3 it tends to be cancer. But certainly for diabetes being in anywhere from 8 to 12% of an employee population, we have some groups where it's close to 15 to 20% of their employee population. Mental health, OBGYN, and prescriptions. Okay, but not communicating with spouses is often a major blind spot, right? So you're like, okay, well I got quote unquote captive audience in my employees, but with the dependents, not so captive audience. So not communicating with spouses is often a major blind spot. So if there's plan design changes or changes to a consumer-directed health plan, or if there's premium differentials for like activity in a wellness program, et cetera, or various other incentive programs, if you're doing that just for the employees, you're missing out on like 30 to 60% of your claim spend that's driven by dependents. Okay, so these are strategies for moments of magic from your peers. So 1, include the spouses. And I'm going to actually read these. Okay, so we encourage employees to invite their spouses to open enrollment meetings. They ask great questions and family decisions are made faster. So we get 100% benefits enrollment by our deadline. Notice that oftentimes benefits decisions are delayed because they haven't quote unquote communicated with their spouse. Well, by helping to facilitate that communication, you can actually get things done on time for your open enrollment. That's a great idea from a large office furniture dealer. Be personal. Open enrollment is 2 weeks long, and we have face-to-face meetings with 750 plus employees and their spouses. So much can get lost over the phone, and we want to build that personal relationship from a North Texas city. Okay, now, obviously not all employers are able to do that because of the way they're spread out across the country, but at a city, at a municipality where you have a high concentration of employees in one general location, you can do that. Okay, make it easy. We make videos for our open enrollment meetings and share them with employees and spouses who are not able to attend. I will tell you, over the last 5 years, I've seen more and more video use. And I've told you this before, but I personally have presented at over 200 open enrollment meetings. I kind of jokingly say that I'm the only physician in America that has presented at 200 open enrollment meetings. I might be the only one. And I'm a videotape. And they're like, Dr. Bricker, can we videotape? I'm like, sure. And so they'll tape me, and they'll either use it during the other meetings, or they'll use it during their new hire orientations for people that are hired in like March, May, June, July, whatever. So I've seen more and more video use. Provide online tools. Provide an online tool to assist with open enrollment decisions that can be used at home with us. I've seen some online tools. They're awesome. I mean, they're great. And so again, not everybody is, quote unquote, in front of a computer, et cetera. But for those folks that do have the ability to do that, that is a great resource as well. 2, retiring or changing jobs. So challenges. COBRA is very expensive. Potential lack of health insurance coverage, confusion about purchasing insurance on the exchange, and questions about Medicare and Medicaid Advantage. We have Medicare and Medicare Advantage. We have a fair number of groups, clients of ours, where they have their pre-65 retirees on their plan, or they have some sort. Maybe they'll transition them to an exchange. But a lot of times for their pre-65 retirees, especially for municipalities, they should keep them on their plan. And so there are absolutely financial ramifications for the plan, and they're no longer employees. So how do you interact with these folks? One, be grateful. We provide a retiree checklist. We value the way we say hello and also how we say goodbye. We want to provide an easy experience that our employees can trust. Our small way of saying thank you for your years of service at a very large airline. Be compassionate. An ex-employee passed away. Our retiree benefits were secondary at the time. The widow was overwhelmed, so we called the hospital, provided insurance info. In turn, the hospital wiped her bill clean due to death. We have since added Compass availability to our retiree population, diversified holding company. So this is where, for those, again, it's not required, but for folks that have pre-65 retirees on their plan, we have been able to help those folks. They do, of course, no generalizations here, but they do tend to be older. They do tend to have more health issues. They tend to be more complex. And so the key is to be able to develop a communication strategy to actually get to those people. It can be done. I will just quick, without getting into the details, I will just say where there's a will, there's a way. But if you can effectively communicate with those folks, and a lot of times they typically call into HR, and so it's really a conduit through HR to get the word out to those people. But that's been very helpful to them because their needs tend to be very complex. Number 3, addressing issues with the insurance company. Moment of truth. The challenges around there. EOB statements can be confusing. Billing errors and confusion over coverage. Hassle of getting pre-authorization for procedures. Unsure of right questions to ask and need to make repeated calls during work to handle issues. And I would say the middle one, hassle of getting pre-authorization for procedures, is only increasing. I've written a blog about this previously. The number of tests and procedures and even specialty pharmacy medications that are requiring prior authorization is only going in one direction, and that is up. So it's sort of like back to the future. It's like back to the late 90s in terms of the way things used to be. Because guess what? When those prior authorizations were put in the late 90s, it totally decreased, quote-unquote, overutilization of those services. Now, it was very cumbersome. People didn't like it, and there was the essentially the backlash against that. Now, it's literally 20 years later. Technology is much better. We have advocacy concierge services like Compass to help out with this now, and so prior authorization 2.0 is essentially happening more and more, and we see it more and more with our clients every year. So here's some ideas again from your peers. Go the extra mile. Take additional time to explain our high deductible plan to our high-risk population so they can experience the plan with the lowest out-of-pocket costs from an oil and gas company. So it's a matter, really it's a matter of managing expectations. And so it's not just a question of the benefits that are being provided, it's the expectations around those benefits. So if those expectations are appropriately communicated, I'll tell you, for Chili's Maggiano's Restaurants, for Brinker International, they did a fantastic job communicating expectations across their employees. And sure enough, and they did 100% replacement CDHP plan. Sure enough, the first year they had a little noise. By year 2, a little bit, and by year 3, it was almost gone completely. So it didn't happen overnight, but it really was minimal because they really took a lot of time to communicate out to the employees around expectations around how that plan works. Offer alternatives. If we have to return an unfavorable answer, I always try to offer possible solutions, even if it means additional research on my end for a financial services company. Excuse me. Do your homework. Before meeting in person or returning a call, collect information on that person, such as their department, length of service, etc., to assure the person they are important to me and I have information to assist them. Be responsive. Always return benefits error calls on the same day, even if on evenings or weekends, to acknowledge we received them. And this is where Chef Hyken talks about this in his book, where he says, well, how can we create moments of magic? There are some simple things that we can do. So one is the classic under-promise and over-deliver. And we can over-deliver in terms of our responsiveness time. So people don't necessarily expect us to answer in the evenings or on weekends. So if you do that, you've sort of created a moment of magic. You don't have to fix it at night or on the weekend, but just to acknowledge it is really creating a sense of assuredness on the part of our members. Health plan moments of truth number 4, open enrollment. Challenges, lots of confusion. Unsure how to compare different health insurance plans. May sign up for a health insurance plan and not fully understand deductibles, etc. I would say there at a basic level, the whole concept of an embedded deductible or a family deductible versus an individual deductible, to this day, it's still confusing for folks. Okay, so if my deductible as an individual is $1,000 and for the family it's $2,000, you mean to tell me that 4 people can reach $999 and it won't reach our family deductible? Yes, with some plans, that's absolutely true. So it's important to explain that dynamic of how it works. Okay, make it simple. We provide individual cost analysis to help employees choose the correct plans at open enrollment and at different life events. Notice this is an engineering company. Only an engineering company would they do individual cost analysis. So obviously not every employer would want that, but at an engineering company, they would totally want that. And they know their employees and they provide that to them. This is great. We arranged webinars and in-person meetings to talk to employees about our program and answer their questions. It lets employees know we're there for them. Okay, so both, look at that, both webinars and in-person meetings. Okay, go the extra mile. During open enrollment, we switched carriers, and I personally stayed late every day to call employees and confirm their plan choices. Okay, so that personal touch. Offer healthcare navigation services. We hire Compass and refer our employees to them for open enrollment questions, open enrollment questions and benefit questions, etc. for North Texas law firm. So I'd really say there that a lot of employers that really just want the best and really want a lot of hand-holding space. I mean, obviously for that, go that extra mile for that North Texas healthcare company, they were themselves within HR and benefits having to spend a lot of time. Well, your company might just be so big that that is just humanly impossible for you, and that's totally okay. And so you have to have leverage and extension of your team, which, Compass can do. And I won't go into the details more around that, but just know that that is, and if anything, I'd say that's probably more and more of what we see in terms of helping people during open enrollment, which can be very confusing and overwhelming in terms of the amount of information. Number 5, receiving a diagnosis. So this would be like a new cancer diagnosis. So we literally get a call in from a member about a new cancer diagnosis, literally 1 to 2 times a week. Another thing that I was shocked about, and some of you have heard me talk about this, is we literally get 1 to 2 referral requests per week for addiction treatment centers. It's an emotional time. You're unsure of the next step. Time is of the essence. So if the employee typically has like a teenage son or daughter or a young adult son or daughter in their 20s, still on the plan, under 26, and these addiction treatment centers, some take insurance, some don't. Some are in network, some are out of network. Some you'll get quote unquote approval for like 14 days of inpatient stay, but then you got to get it reapproved every 14 days. And oh, by the way, like almost everybody has like never done this before, and they're obviously incredibly stressed out. They have incredible concern for their family member, and it's complicated. And so to like pull away that emotional fog of what's happening right there is incredibly hard to do. Like no one should be expected to do that. So to have somebody who's like done this before lots of times and can rationally address the situation is super helpful. And I had no idea when I was talking to our health pros about this a few years ago. I had no idea that we were doing this so much. And it's, you read about, opioid epidemic, in the newspaper, and it really is a lot of prescription drug addiction. It's unbelievable. Anyway, it's a total privilege and an honor to be able to help people in that situation in their lives. Okay, receiving a diagnosis. We've implemented a second opinion service for serious diagnoses to cover people in difficult situations. So this is where Compass can actually steer people into those second opinion services should you hire that type of service. Offer healthcare navigation services. An employee's daughter needed jaw surgery. Compass found an in-network surgeon and coordinated with insurance and provider to have the procedure pre-approved. So we have some clients that frankly have hired us like only for, I should say only, in many ways for the prior authorization and denial process. But they're like, look, we got benefits. We want people to use them appropriately, and they're kind of getting denied stuff, more so than we would like. Or denied the wrong way, or it's cumbersome, or it's creating a lot of noise and dissatisfaction in our plan. So we still stay within the plan documents. We're not trying to do anything outside of that, but it's just making that process much more easy for the employees and their family during a stressful time. Because a lot of it's based on medical policy, and you've heard me speak about medical policy before, and that medical policy is depending upon the individual clinical scenario. And we facilitate getting the documentation from the doc over to the medical reviewer at the carrier And sometimes it's completely appropriate. We had one gentleman who, his ophthalmologist wanted to do a particular laser surgery in the office on his retina, and it was not one of the quote-unquote approved diagnosis codes in medical policy for this particular carrier. And the ophthalmologist was like, that's crazy. I do this all the time. There's no reason not to do this surgery. It's lower risk, it's lower cost, you have better outcomes. Why would you not do this? And so we worked it through the appeals process, and it was totally approved, which is totally appropriate. But again, if someone was to have to do that on their own, it would take a lot of time and be frustrated. They don't do this a lot, so they've never done it before. So that's just one example. Provide peace of mind. It was a huge relief to have high-quality screened caregiver for our daughter to get care while out of state at college. So we have a lot of folks, again, people are on the dependents are on the plan, but they might not be living at home. We had one person who was a student at Texas A&M University, was a type 1 diabetic, and her insulin kept getting delivered to the outside of her dorm, and it wasn't being refrigerated properly, and she had to throw it out. And so we literally coordinated the delivery so that she would be there for the delivery so that she could take it and not have to throw out her insulin. This happens with specialty pharmacy medications. People would literally throw out $3,000, $6,000, $9,000. We had a Compass employee's spouse themselves threw out $9,000 of specialty pharmacy medication. And so obviously that's wasteful. There's no reason to do that. I mean, that's like throwing out a diamond ring. So there's ways to prevent that from happening. Be compassionate. Listening to an employee whose family is going through a tough time and show concern. I think I might have mentioned this before, but when I went to one of the weddings of one of our employees, her officiant, which is awesome. He's actually a hospice minister, but he was an officiant at their wedding because her mom was a hospice nurse, and so they asked her friend as a favor. And he said, love is spelled Time. And I thought, wow, truer words have never been said. And so to the extent that we can show time for our employees, and obviously there's only so many hours in a day and we're pulling a gazillion directions, but when we show time for them, it just shows that we care. Okay, general recommendations. Meet employees where they are. Create proactive opportunities to educate employees versus relying on them to contact you. So where people are in their quote-unquote healthcare journey and their degree of healthcare literacy, even within an employer, is all over the map. So you have to meet people where they are. Be insightful. Provide helpful tips for using your health benefit. We've seen a lot of this incorporated in open enrollment guides. So it's not just your deductibles this, your co-insurance this, it's actually putting those tips. So it's almost like a how-to. It's almost like a how-to guide. Be personal. Personalize new hire benefits orientation. Sit down with employees one-on-one if needed. So for companies that have a lot of turnover, so retail, hospitality, nursing homes, warehousing, logistics, some of these firms have 50, 60, 70, even I think our highest ever was 80% turnover. So open enrollment really wasn't the issue. It was new employee orientation is really where you got people. And so, and sometimes if it's large employers, they can't do it one-on-one, obviously, but they'll do it through video and through their online portal. They'll even incorporate video in the portal. That has worked great for some employers. Be responsive, under promise, and over deliver. I already mentioned that from Shep. General recommendation number 2. Be fun and engaging. Make employee calls to the benefits team fun and relaxing by making them laugh and or have some little treat for employees who visit your office to make them feel comfortable and at ease. Of course, I have to mention that Southwest Airlines is the ultimate pro at this. And, they make you laugh on the plane. They make their employees laugh, too, internally. I mean, I've seen it in meetings. And it's like they make an intentional effort to do that. And obviously not everybody is a comedian, which is totally fine. And they basically laugh at the fact that they tell bad jokes. And it really falls along with that philosophy that has really not only made them successful, but many companies successful. And that is, if you take care of the employees take care of the customers, and the customers take care of the business. And it's really in that order. Make it easy for employees to get the answers they need. Offer healthcare navigation solution like Compass. So, of course, that's what many employers have done. And so to that end, specifically, as a personal healthcare concierge, Compass helps employees understand their benefits, find quality providers, guide people to the right programs at the right time, whether it be telemedicine or EAP or wellness or disease management. save money on medical care through price and quality transparency, coordinate care through second opinions or moving medical records from Dr. A to Dr. B, helping lower the cost of prescriptions, getting help with their medical bills when they have to do an appeal or they have to resolve a coding problem, etc. And so, if anything, I really want to thank and credit all of you on this line. We started using the term healthcare concierge 10 years ago when we started doing this. And it's like a thing now. People talk about a quote-unquote concierge solution. I literally have HR people and brokers calling me saying, hey, we're looking for a concierge. They're using that word. I'm like, I cannot believe that. Because, I mean, we were using that word 10 years ago, and everyone's like, concierge for benefits? It's kind of weird. And so I really appreciate all of you spreading the good word across your employers. Many of you have like moved from one job to another because you had to move your family for personal reasons, or you just changed jobs, what have you. And you've taken Compass from one employer to another, and that's what's been awesome. And so it's really been with your partnership that we have really sort of proselytized this across the country, and it has just helped people in ways that I would have never imagined. I mean, we have literally members in Seattle, and San Diego, and Florida, and Michigan, and Kentucky, and it's like, these are places that I would have never dreamed being able to help people navigate the healthcare system. And their lives are literally being made easier. And it's such a privilege and an honor for me to be able to lighten somebody's load as a result of being able to work with all of you. And of course, because we live in the 21st century, we have to lighten people's load with apps too, right? You can't just lighten people's load with your awesome Health Pro Lauren, but new for 2017, of course, you have your app for your bank, your app for travel, so now you have your Compass app as well. And what's really neat is, I think some of you have heard me talk about this before, is about how we've actually taken a picture of every single one of our Health Pros, so that when you log into your app, you actually see a picture of your Health Pro. So it doesn't seem like random black box, it's like your Health Pro. And you can do the in-network price transparency on the app, or you can like auto-dial or auto-message your Health Pro like through your app. So it's a great blend of technology and professional personal assistance. So, and with that, that brings us to the conclusion of our webinar. I will ask if anybody has any questions here, feel free to type them in. I'll just bring a couple of things to a close. One, we have our healthcare consumerism blog. We write it weekly. We typically email it out on Thursdays. If you'd like to subscribe to the blog, just go to compassphs.com/blog. You can see it there at the bottom. The readership is like tripled. It is tens of thousands of people now that read this, and so it's really great. And many of you who are on this webinar actually read the blog as well. And then I will also add that here's a summary of all those moments of truth. And I will add that, as always, I'm always asked this at the end of webinars, if you would like a copy of these slides, please email me, ericv@compassphs.com. I would love to send you a PDF of these slides, and so you can have them as a resource. We have some people that are on these calls where they literally ask for the slides every time because they're like developing their own library, and that is totally fine. I appreciate you doing it. If you have any questions, please feel free to ask them now. But if not, then I will just say I am super appreciative of you giving me the most important thing that you have, which is your time and attention. And with that, I hope you have a great rest of your day and your work week.